Welcome back. So it does seem that we had our lines crossed there. I have not met my next guest, who is Dr. Mpe, Martin Mpe. So I didn't recognize that it was the wrong person that we were speaking to. So we do apologize to you, the viewer, as well to Dr. Martin Mpe. We're talking about, there's an apparently an untruth circulating, encouraging people suffering from high blood pressure to stop taking their hypertensive meds. And the medical profession, through bodies like the South African Hypertension Society, wants to set the record straight. Dr. Martin Mpe is a Gauteng-based Cardiologist and President of the South African Hypertension Society, joining us live. Doctor, I do apologize. I was throwing you some tough questions there. First of all, with regards to allegations of PPE tenders, so I do apologize for that. But let's get back to the issue at hand and why you came on in the first place. And you say there's this misinformation, Doc, that's circulating, encouraging people who are suffering from high blood pressure to stop taking their meds. Why is this dangerous?
Yeah, thanks, Blaine, and thanks for getting the script right. Yeah, hypertension is a very common condition. Prevalence is of well over 60% in people over the age of 50. And then if you look at the national average, you are sitting at around 50% plus. The problem with high blood pressure is that it's a silent killer, and every 3 seconds, somebody would succumb to complications associated with hypertension. And it's therefore important that for people with hypertension, the blood pressure should always be controlled to prevent these complications. However, now with COVID-19 in the mix, people are being advised that some of these hypertension treatments can be dangerous for people with COVID-19 because it can expose them or predispose them to severe disease and maybe even complications of death. And that is not true because hypertension, as we know, is also a comorbid condition which, should it coexist with COVID-19, it may lead to severe disease and death in some instances. And those people who contract COVID already with their blood pressures controlled tend to have a much favorable course when they are inflicted with COVID-19, and is therefore not advisable for anyone with high blood pressure to stop their medication for any reason, especially so for people who contract COVID-19.
Right. So I've heard that high blood pressure being called the silent killer. Tell us how common it is here in South Africa, Doc.
Yeah, there are two big problems here. In South Africa, the prevalence of hypertension is very high, well over 50% on average, and then as people grow older, the incidence even increases. That's number one. Number two, of the total population of people with high blood pressure, more than 73% of them are not even aware that they've got high blood pressure. Only 27% of individuals with high blood pressure would have measured their blood pressure at some stage and be told that their blood pressure is high. The sad part is that even of the ones that know that they've got high blood pressure, only half of them are on treatment. And for the ones on treatment, only 7% are controlled. I think this is very dismal.
I want to talk more about that and certain remedies, but I want to get back to high blood pressure and COVID-19. Tell us more about what the research is telling us with regards to symptoms and complications, because our knowledge and the data that's coming through is forever evolving with regards to COVID-19. There's so many variables, so many metrics to take into consideration. What are we learning with regards to this link?
Yeah, what we are learning is that there are certain conditions, chronic conditions, which when present in an individual that contracts COVID-19, they tend to predispose to a more severe form of disease. And hypertension has been identified as one of those, although the more bigger confounder is the age. The older the individual, the more likely that the disease would be severe should they contract COVID. And a combination of hypertension and increased age is even more deleterious than just hypertension or age in isolation. So the more comorbid conditions one has, the more likely the disease is to be severe should they contract COVID.
Right.
And when the understanding was still in its infancy on how COVID infects the cells, some receptors which are known to be on the cell surface through which the virus infects the cells were also thought to be the same receptors on which some of these blood pressure medications work. And the thinking was that if you're on blood pressure medication for those two drugs, your ACE inhibitors and your angiotensin 2 receptor blockers, the presence of those drugs would then predispose you to a more severe disease. But now we know that those receptors are not necessarily the same, and it's actually very safe to use those drugs. And those drugs have other benefits beyond blood pressure control. So with our understanding currently, all blood pressure medications should be safe to use and actually should be used in patients with or without COVID.
So I tested my blood pressure the other day and the nurse told me that it was high. So she says, "Are you stressed out?" And I said, "Of course I'm stressed out. I'm a news anchor. I wake up stressed. I go to bed stressed. This is my life." She says, "Calm down." How on earth do I just calm down like that? So stress is one part of, I guess, pushing up your pressure. The question is, how do we beat high blood pressure if you live constantly in a stressed environment? What are the foods that we need to be eating? If you test your pressure, is it automatic that you go on medication? What's the process here? Help us understand this.
When we deal with blood pressure management, there are a number of variables we look at. Number one, we look at the absolute blood pressure reading, whether the elevation is mild, moderate, or severe. And we also look at the presence and extent of other risk factors like smoking, obesity, diabetes, and the presence of complications like your kidney involvement, previous strokes, heart failure, and so forth. So not all people with hypertension are the same.
Yeah.
And the other thing we look at as well is for those without other comorbidities or other risk factors whose blood pressure is very severe, we are not going to delay onset of medication. So somebody with a very mild blood pressure elevation who does not have other associated risk factors for heart disease and doesn't have complications from the high blood pressure itself, we advise on lifestyle modification, because even in those you find that one drug with a smaller dose of one drug may be able to control their blood pressure. So the important thing for the nation is lifestyle modification. Right. Do not smoke. If you drink in moderation, we should all try and exercise about 45 minutes 3 times a day. We should try and maintain a healthy weight, cut down on salt, cut down on sugar, and we should also cut down on fat. And I think that applies to all of us, whether hypertensive or not. And then things like stress, we need to learn stress management techniques. Yeah. However, but the rest of the other lifestyle modification strategies should be on board regardless.
So keep away from salt, keep away from sugar. Is there any other foods that we can eat to lower the pressure?
Yeah, we know that bananas are rich in potassium, and a lot of us are potassium depleted. So potassium salt tends to help. But other than that, if we have a healthy diet, more vegetables, and we try and have more refined vegetables, and then try and minimize your refined carbohydrates, that should be enough with the other lifestyle modifications that I've alluded to. But other foods necessarily to drop the blood pressure, there isn't much really, except that we should stick to a healthy lifestyle and keep the other risk factors controlled.
So insightful. Consequences of high blood pressure is, I guess, robbing us of loved ones every year. And some of these fatalities we could have prevented. We appreciate your time and your expertise on this issue, Doc. It's an issue that we need to shine an even brighter spotlight on. Dr. Martin Mpe, best of health to you and your family. Thank you very much for joining us. Be well.
Sure. Thanks for having me.